Our life is so full of wonders. It never ceases to amaze as we feel deep within us the ever-throbbing pulse of life around us. The earth keeps renovating life with unfailing enthusiasm.
So as the health of a human body and the reconstruction of health is a big wonder, but when and where it's an important question where the complete health venue, MIMS, is the best answer.
Welcome to MIMS,
the Malabar Institute of Medical Sciences.
Superior health care of international standards is your birthright as a citizen of this world. Each medical research plan that MIMS has developed in order to ensure a superior healthcare system of international standards has been able to complement the present international healthcare enterprise and also serve as a model of excellence.
MIMS was started in 2001 at Calicut with just 300 beds. After 5 years, we expanded it into a 600-bed hospital. Apart from that, we are planning to start MIMS hospitals at Kannur and Perindalmanna. With the expansion of MIMS Calicut, where we are starting a women and children wing, which will take the total bed strength above 1,500. The more important thing that MIMS is doing is to go up in that technology chain, where it is going to the highest level that's available anywhere in the world.
Accuracy and lucidity that come with advanced radiology and imaging technology help us take you to the experts in the field in the right time.
على العلاج وفيه الموظفين المختصين وفيه الصحفيين المختصين.
Nuclear medicine imaging procedures helps to identify abnormalities very early in the progression of the disease. This early detection allows the disease to be treated early in the course when prognosis is better. MIMS Nuclear Medicine Department has state-of-the-art gamma camera, diagnostic PET-CT and most advanced PET-CT facility for various radionuclide therapies. It also offers an exclusive thyroid clinic for diagnosis and treatment of various thyroid conditions.
I underwent my cardiac perfusion scan at MIMS Nuclear Medicine Department, and it is precisely ruled out major coronary heart disease.
Together, we can confront the least anticipated but most fatal diseases that often threaten to put out the eternal flame of your life.
MIMS Oncology Center has played a major role in removing the stigma of cancer being an incurable disease by early detection and more sophisticated treatment.
Whatever nationality or culture you belong to, restoring lost health is one of the fundamental duties of any individual. And it is this very fact that MIMS seeks to uphold on the world's health map.
Instances of casualty that pose a threat to your life, amazing recoveries from various such accidents that form major catastrophes of life. MIMS claims with immense pride that we have restored the shine not of one, but hundreds of fading stars.
The story of this patient was an irony. He was one of the best EMS staff in the department.
This patient came in shock, which means he had no pulse in BP.
That day we just picked him up from the site in a mobile ICU, and when I saw him I was so shocked to see the situation was so terrific that he was having full blood all his face, was not responding to our calls. When we checked his vitals, he was so poor.
On arrival in the emergency department of MIMS Hospital Calicut, he was very promptly received and resuscitated. It was a die-hard situation. Even after 5 minutes of cardiac massage, his heart did not start working, did not start pulsating. But they did not leave it. They worked die-hard. From asystole, from a non-pulsating heart, his heart was brought back. When the heart started beating, we decided that this patient could be saved. After fully resuscitating this patient, patient was taken to OT after a CT scan. The CT scan showed an intracranial clot with a lot of facial-maxillary injuries. Intraoperatively, the whole clot was a very large clot and it was evacuated. But the brain was still bulging and we had to do a relaxation duroplasty plus a decompressive craniotomy. Perhaps these two steps in the surgery saved his life and saved his brain. Operated this patient as emergency in the middle of the night and ventilated the patient overnight in the ICU. But I was always concerned whether this boy will make back to useful life. As in any trauma, rest is in the hands of God, and God did play the wonder work. Happy to say that he is back to work in his life with almost no disability.
Not safe. He is just active as before.
This is achieved by providing the necessary treatment as a team. Individually, doctors may be good, but when they are a team, they become an excellent proposition for the patient.
Many a time, does your lifestyle render your delicate heartbeats or the heartbeats of your children off the track? If so, we are here to bring back the right notes to the music of your heart and make your life more colorful than ever before.
I can't imagine a day without my dad. He's a source of my inspiration.
This gentleman had chest pain at home. We sent a mobile ICU to pick him up. The doctor in the mobile ICU said he is having an anterior wall MI. On reaching the emergency department, he was in pulmonary edema. He had severe chest pain. His ECG showed an anterior wall MI.
Immediately he was given all the required attention and he was admitted to the cardiology department.
It was hard for me to accept that I'm a heart patient with multiple blockages.
As soon as he entered the cath lab, he developed cardiac arrest. And in situations such as this, we are happy to say that we have people at MIMS. Within no time, there were 6 cardiologists in the cath lab, 2 anesthesiologists, and a whole team of paramedical personnel. One person put in an intra-aortic balloon, the other was resuscitating, and the third cardiologist was going ahead with the primary angioplasty, the only way we can attempt or even dream of saving him. And what we found was the left main coronary artery was blocked completely. Generally, these patients do not survive. We went about our work with great dedication. The whole team. In between the procedure, we had to shock him multiple times. Each time we shocked, we waited. We badly wanted to save him. And after about 30 minutes, we could come out. His blood pressure was maintained. All this could have been possible only because of the concerted team effort which we are proud to say is available at MIMS.
Thank you, MIMS, for the teamwork and experience you have put in to give me back this wonderful day with my family.
When you look at the procedures being done at MIMS, we do everything that's possible anywhere in the world, starting from primary care to the most advanced quaternary care.
The mind that yearns to move forward and feet that are ready to take a step. Life is constantly progressing. At each step is gained not only a new freedom, but joy and contentment. MIMS takes you there, where your mind aspires to be.
I have miles to go before I sleep, but my knee problem does not allow me to take a single step forward. I trust MIMS Department of Orthopedics.
MIMS is a center which is performing a large volume of primary and revision joint replacement surgeries, including the total knee arthroplasty, total hip arthroplasty, total ankle arthroplasty, and primary as well as the reverse total shoulder replacement surgeries. The way of doing the surgery and the post-operative rehabilitations which are given by the Department of Orthopedics in MIMS definitely will ensure a quality of life and a smile in the patient's face in the near future.
We open the door to the world of sound and add the gift of melody to your life. By working together in harmony, our team of experts accomplished this task.
Music was my life. I never missed a single wave of it. But suddenly, it started fading away. MIMS Institute of ENT and Head and Neck Surgery was my single hope.
Staffed with highly trained ENT surgeons, audiologists, auditory verbal therapists, and equipped with state-of-the-art equipment, we provide quality ENT treatment to help the patient to regain his normal life.
Purification, a vital process that should take place within your body at all times. MIMS throws light on the importance of purification before you.
With the advent of 3D laparoscopy, what you cannot see by your clinical assessment and ultrasonography, you can view by the laparoscopy. And all these cases can be discharged within 24 hours following surgery.
I needed surgery. Thanks to MIMS Hospital, the surgery went quickly, with less expense than I anticipated, and a procedure that left no chance for infection.
Thank you, MIMS Hospital, for bringing my mommy home so soon.
With a caring heart and invincible technology at hand, there's nothing more valuable in the world than childcare. MIMS has taken it upon itself as a duty, the noble task of giving children the best treatment in the world.
We also run an antenatal guidance counseling center where we counsel parents before birth when they are noticed to have birth abnormality in their child by the gynecologist.
I underwent endoscopy at MIMS GI Sciences. The procedure was quick and comfortable.
MIMS is shaping up a beautiful hope in me. It has given me new confidence.
The technology along with the people, the man behind the machine is as important or more important. So we always stress on the paramedical, nursing and doctors. We have earmarked 5% of our annual profit towards the MIMS Charitable Trust. Through this, lot of patients are being helped. One of such programs which we do every year is the cardiac surgery for the poor patients, especially children.
We have the first multi-speciality hospital in India, with NABH and NABL accreditation.
Prompt diagnosis, analysis, and research have always been the rightful claim exclusive to MIMS in global healthcare.
What we did is to go out of Calicut and start another MIMS hospital at Kotak.
Operation theater complexes, ICUs, INCUs, laboratories equipped with the world's latest and most advanced medical technology. MIMS has its doors open to the corridors of world health 24 hours a day, 7 days a week for quality health care of international standards. Specially trained nurses, specifically designed waiting lobby, outpatient room, patient rooms, wards, and canteen. Promoting a health-friendly atmosphere are all exclusive features of MIMS.
It was a very accomplishing journey, and that journey continues. We look forward to the future for providing tertiary and quaternary care to the people as a referral hospital in Kerala, attracting patients from all over India, all over the world.
Global vision, caring,
and providing them care, compassion, and cure as we go forward.
Welcome to MIMS,
the Malabar Institute of Medical Sciences.
a caring mission,
a global vision.